Welcome. Happy Saturday. Welcome to Dr. J's Prescription for Health. I am your host, Dr. Malia Jensen. I'm a board-certified family physician. I'm located in Iowa. I've been practicing for about 28 years. This is my co-host. This is Tucker. Tucker is co-hosting from heaven. So I want to welcome you all here. Some of you have been here before. Others are new. And I just want to welcome everybody. Tell me where you're listening from, what city, what state, what country. We will get started here as soon as everybody kind of joins in. We are live on Instagram and YouTube, so thank you all for joining. This is an opportunity for you to ask questions, health-related questions. This is Buddy. Buddy is here for appearance only. He's not much help as far as answering questions, so he sleeps through most everything. So that is my rescue buddy. Good morning, Lucy. Thank you for being here. You have a commitment with a friend. Okay, that sounds good. If you can check in and out, that would be awesome, but we appreciate you. Cynthia is listening from Woodlands, Texas in the USA. Thank you for joining, Cynthia. I'm in Iowa, so we're probably having about the same type of weather, I'm guessing, but who knows? It's been seasonal here. That's a good thing. Okay. All right. So, Lucy, do we see any questions here? Marshur is listening from Finland. That's awesome. Thank you. It's got to be about evening there, I'm guessing. 90s and humid. Yeah, it's same here. It is a little distressing, but the alternative is 90 below zero and freezing cold with ice and snow, which you guys don't get. But honestly, I will take this humidity and the heat. It's 5 p.m. there. Yeah. I'm not one for the cold anymore. Who knows why, but I'm getting older. I don't want to shovel snow. I don't like the ice, and I surely do not like having to wear 4 jackets to keep warm. But I do live in Iowa, and I choose to live in Iowa, so don't feel sorry for me. This is where I choose to live. Cynthia says, okay, I'll take this instead. Darn right, because your winters are much nicer. Although when you get snow and ice, it's like devastating, and I'm sorry about that. We have at least some protective measures against the snow and ice. You guys don't. So when it comes, it is devastating. I follow. All right, today we are going to talk a little bit about irritable bowel syndrome, especially irritable bowel syndrome with a predominant of diarrhea. And we're going to talk, thank you, Lucy, we're going to weave this in to insulin resistance or metabolic syndrome. Because the two conditions frequently cluster together, scientists or researchers have set out to find what I believe is a molecular link, okay? And there was one such study that came out. It was in Cell Host and Microbe Journal, the Journal of Cell Host and Microbes. And they took patients with irritable bowel and screened them for metabolic syndrome markers. And if you recall, metabolic syndrome is a constellation of 5 symptoms or diagnoses: high blood pressure, high blood sugar, high triglycerides, high waist size, and low HDL. That is metabolic syndrome. So these researchers took irritable bowel diarrhea patients, screened them for metabolic syndrome, and then they compared the blood and the stool of this group of people. And they did this type of profiling, this microbial profiling. It's extensive, not just looking for one marker, but looking for a ton of different markers. Okay. They were trying to figure out a link, and they kind of did. They found that there are fatty acid ethanolamides were the common bridge between these two conditions. So when you first read the study, you would think this is just a coincidence. These irritable bowel people and the insulin resistant people have a deficiency of these FAEs, especially OAE. OEA? Maybe it's OEA. It's a type of fatty acid, okay? Bacteria produce these fatty acids, and the gut needs these fatty acids as a gut shield, okay? There's a shield to prevent inflammation, prevent gap junctions. I mean, if you have gaps so you have a gut lining, and they're lined with cells, and the cells are supposed to be tightly joined together, okay? If we get inflammation in the gut, we develop gap junctions. They're not tight junctions, they're gapped. And then bacteria that release lipopolysaccharides, endotoxins, those endotoxins can go through the gaps and then get into the bloodstream. And then they cause inflammation in other places, okay? So we need these bacteria that make these short chain fatty acids. And when we have IBS and insulin resistance, we have less of these bacteria that make these short chain fatty acids. That is the whole gist of this this study that was recently out. So people with chronic gut inflammation and rapid motility are seemingly at risk for metabolic syndrome. So usually what happens, you guys, is if somebody comes into their doctor and they got IBS-D, the diarrhea component, okay? IBS-D, and they got the diarrhea component, they're going to be sent to, for the most part, I mean, some family practice will take care of it. They'll try some medicine, but they're going to send a GI. And then the metabolic people are going to be sent to endocrinology. And then there's never really anything that those two specialties are tying together. Okay. So why do you have IBS-D? Do you have gut, bacteria from different diet, from stress, from whatever, okay? So we all hear about gut microbes, but the two specialties aren't talking. And especially the endocrinologist is not really linking anything about your diet. They're just going to go straight to the medications. Now, what if you have another thing about these bacteria, and this is really interesting when I was reading about it. So this special bacteria, the OEA, which is an FAE, he's a fatty acid ethanolamide, okay? And he builds up this gut lining, this shield. But one of the things that this shield does is it clears excess serotonin. Remember, serotonin, one of the largest receptors in our body. You would think it would be in our brain. It's in our gut. So it clears excess serotonin. So when you have good functioning bacteria, it's going to clear the excess serotonin, because the serotonin is going to increase if it's not gotten cleared, right? It's going to increase cramping and diarrhea and all of that, okay? So you're actually worsening a problem if your doctor goes and treats your depression that caused your gut problem. You're making more serotonin available in the gut, and it can't be cleared because you don't have the bacteria with the shield. Interesting, right? And so a lot of times you can be given these SSRIs, serotonin reuptake, selective serotonin reuptake inhibitors, and it actually worsens your gut problems, but mellows out brain function. and you say, I'll live with it. Or you'll go to the GI doc and now you're on 2 different medications. Crazy. So that's the mainstream, way of medical answer is they turn to a referral, or worse yet, can you imagine, you guys, in the future that, so say this study from Cell Host and Microbe journal goes viral, and drug companies bite onto this. They're going to synthesize a fatty acid. We're not going to worry about the root cause. We're not going to worry about your poor diet, your chronic stress, you're not sleeping, and that's what destroyed your gut bacteria. And that's what prevented these fatty acids from being made, and then the gut shield. No, pharma's going to hook on, and guess what they're going to do? They're going to make the fatty acid, a synthetic fatty acid. That's what our modern medical system is doing. So it's just interesting. I dug deep into, why this study, like for instance, why would we have even picked out IBS-D and insulin resistance as 2 groups? That wouldn't even have crossed my mind. I mean, initially, once I read the study, then it does, but it doesn't really cross my mind about, let's go compare IBS-D, not IBS-C, constipation, but IBS-D and insulin resistance. And let's do a microbe study on them. I mean, it would just have to be a wild hair idea that I wanted to study these 2 groups of people and find out a common denominator, which links back to these short chain fatty acids that are in low production. I don't know. It just seems kind of out there, but again, that's why we have researchers. David says, I never understood why psychiatrists never do brain scans. You can't treat what you can't see. So David, what would you be looking at for a brain scan? Like what could a brain scan tell David about, psychiatry? What more information would it give you that, I'm just asking, I want to get your ideas on it. Let's see. Vespillo asks, can an infected crown root cause a fluctuating CRP between 6 and 21? Absolutely. Yep. Anish, thank you. And you as well. I appreciate that. Hello, Isis. Okay, you're welcome, Vespillo. Okay, we're live on Instagram and YouTube right now. So if you have a question, bring it on. I'll try to answer them. David says, what areas light up and what areas are dormant? So this is interesting, David, and I didn't really need a brain scan to explain this to me. As I was reading, when I was thinking about this serotonin thing and how doctors, it's really the patients. The patients will come in and they're not really linking their depression or anxiety or their panic or whatever their psychiatric complaints are. They're not really linking it to their gut. They've been trained this way as we have systems. So they have a gut problem and then they have a psychiatric problem, or they have a respiratory problem, or they have a cardiovascular problem, or they have a urology problem or a neurology problem. And we've actually done that to people. Well, not we. I don't know who's the start of it. I mean, is it big pharma? Is it big food? Is it big whoever? And they divided. It used to be that we would have a doctor, and a doctor would do everything. But then these subspecialties came into play, I don't know how many years ago. And so now we have a gynecologist and a urologist and a pulmonologist and a neurologist and an endocrinologist and a cardiologist, all of them separate, all divided, all never really talking to each other. So nonetheless, I'm thinking about this gut aspect, and I'm thinking about the depression aspect, and then I'm thinking about what areas of our brain get activated or not activated. And I don't really need, for me, when I'm thinking about this, David, I don't need a brain scan to tell me that when people, for the most part, in modern world, are stressed out group, they are a stressed out group of people. Some handle it better than others, and some not. And so those people who are in chronic fight or flight, we've been taught that, oh, okay, if you're in chronic fight or flight, you're always going to be releasing cortisol, and you're always going to be on edge, and you're just going to be in this nervous state. And that's why you have insulin resistance, and that's why you can't sleep. And it's all because of the cortisol, chronic cortisol. And when I started going down rabbit holes, it isn't active fight or flight, active cortisol. These people that actually come into this, David, is they're in a high functioning freeze state. It's almost like task paralysis because the brain has been in chronic fight or flight. It overwhelms the nervous system over years. And then the brain realizes that it's actually running away or fighting. The brain realizes that when you run away or fighting back, it's no longer possible. So the response is to put the foot on the brake and the gas at the same time. And it activates, the brain activates the dorsal vagal branch of the nervous system. Do I need a brain MRI or a scan to figure that out? No, because there's enough studies that show, good afternoon, Mary, thanks for being here. There's enough studies or enough anatomy, enough biology and physiology that we know that because the brain is so chronically overloaded, overwhelmed, it's going to shut down. And when the foot is on the brake and the gas pedal at the same time, it's going to do the opposite of what you think. When you think of fight or flight, when you're in fight or flight, heart rate goes up, you start sweating, blood flow to the bowels shut down, and you go into I got to get away from the lion type thing. But when you're in chronic fight or flight, your body brain recognizes that you can't fight back. So it just shuts you down. It paralyzes you. And so it's going to do the opposite. It's going to lower your heart rate to conserve energy because it thinks that you're in long-term survival situation. You are long-term survival. So this is where the procrastination starts. It's not really laziness. So if you're a person listening, like David might be, okay, David might say, yeah, I do. I just don't even want to go there. So I'll procrastinate. And then you even think that you're lazy. But this is a biological shutdown. And then when these little things hit you, your energy to tackle it or your nervous system puts the emergency brakes on. All right? And then you become frozen. You might not even know you're frozen, but the details would tell me that you are. The task paralysis, the procrastination, and then what happens is you let these things build and build. Because once you procrastinate one thing, you're going to procrastinate other things over and over and over again, and they are going to be like a pimple ready to explode. That is when you go into an extreme, what I would call toxic adrenaline release. The pressure builds up so much that it forces your body out of a freeze into a fight mode. A toxic adrenaline is released and you get angry and irritable and sarcastic and you're unable to sleep and you feel fried and you have guilt and all of these things. And then a single mistake equals danger to you. And the cycle repeats itself. It's kind of a interesting pathway, and it relates to this bowel stuff, to the serotonin stuff, to the insulin resistant stuff. And I think that we get it backwards. Let me take care of something. Lucy is our blue wrencher over there on YouTube. David says Dr. Aman does SPECT scans, SPECT, spectrometry scans. I know if you give certain people an SSRI or an SNRI, selective norepinephrine reuptake inhibitor, you can make them worse. The local GP doesn't even do basic physicals anymore. I would agree. The physicals that we do, David, they're called wellness exams, and they're basically fulfilling bullet points for insurance companies. We have basically, we have a list of bullet points that need to be taken care of in order to get our full pay. And the more bullet points that you go through, the higher the pay as far as levels are concerned. But when it comes to a wellness exam, they are highly reimbursed, and they will, I mean, if I fulfilled the bullet points on a wellness exam, I would rather do 10 wellness exams in a day than 10 other visits in a day, because the wellness exams pay more. Plus, the insurance companies are sometimes hooked up with employers, and they're basically in bed together, and the employers will give the employees incentives to go get a wellness exam. So doctors love that, okay? The insurance companies look at it like we're taking care of you kind of a thing, and we're gonna take care of the employer, and then the employer's taking care of the employee. But the doctor, we're just really fulfilling bullet points. And I'm gonna say with a broad brushstroke, okay? Because there are some doctors who really care, and they really are trying to take care of their patients, but the screening is not really that great. It might just be what we call a biometric. So you'll get your blood pressure and your height and your weight and your BMI, and then we'll get a lipid panel, and that will be about it, okay? And your insurance company will be saying, "Oh, we're doing so many good things for you, and we're going to help your employer take good care of you," when really they're giving you a disservice, because the doctor, are they really looking from head to toe? Are they looking at your hair and your eyes and your ears, and they listen on your neck? Are they listening to your carotid arteries? Are they listening for bruits? Are they listening to your heart? I mean, all the way around the heart, not just in one spot, but looking at each valve. Apartment M is how I remember it. So aortic valve, so AP apartment, APTM. So aortic, pulmonic, tricuspid, mitral, listening on each area all the way around the heart, okay? And listening to the point of maximum intensity. I don't think we're doing that. Are they listening to your belly and for bowel sounds? And are they listening on the aorta? Are they looking at your skin? Are they lifting up your shirt? Did they get you undressed and put you in a gown? There's not enough time. There is not enough time. So what the primary care doctor is going to do is they're going to go to refer you to dermatology for a skin screening exam. They're going to refer you to gynecology for women to do the pap smear, and men, urologists, to do the prostate exam. If you have a little wheeze, they're going to send you to the pulmonologist. If you have trouble with your urine, they're going to send you to the urologist. If you have a kidney concern, they're going to send you to the nephrologist. David, you might be right. The local GP doesn't even do the basic physicals anymore. It's basically a gatekeeper to send you to all the specialists. It's modern medicine. And that's why I encourage you guys to educate yourself. So many people say, Dr. Jensen, can you just dumb this down for everybody so we can understand? You know what? I've had to learn all of this on my own. I have no magic powers. I was born with a brain just like you were born with a brain, and I have chosen to use it. And I unfortunately early on did not use my brain. I regurgitated everything that was spilled into me, whether it started in high school, undergrad, medical school, residency, and continuing medical education, until a point where something has to trigger us to say, something's not right here. And that's when my educational medical school basically I redid it. Again, I have no magic powers. There are many people listening to me right now who are more educated than half the doctors I know. Okay? So I'm giving you guys kudos. You can do this. Put your doctor out of business. You can get the same amount of education in all of these systems. Your body is not individual systems. It's all one thing functioning together, and the dots need to be connected. That's why that study where it caught me off guard in Cell Host and Microbe journal, because I'm thinking, okay, these are two different things, insulin resistance and irritable bowel. Now, I know that they're not, but I was thinking to myself, the endocrinologist is not going to be learning about the gut microbes and the short chain fatty acids and the gap junction, allowing LPS to go through, get into the bloodstream, cause inflammation. One other thing, David, that I failed to mention, I want to bring this right back. When that freeze of our overwhelmed nervous system occurs, guess what? Guess what happens when we have an adrenaline surge and we get angry, stressed, irritable, all of that? Our body sees that as it's almost like a tribal mechanism. Back in the day, whenever we went into fight or flight, you would increase the amount of blood clotting factors in your body. Because if you got bit or trying to get eaten and you got a cut, you had a rush of blood clot factors that would clot up anything, okay? That is primal. And it's still happening today. So if you are constantly in a fight or flight, or you go into a frozen dorsal vagal branch of your nervous system, you're basically in a freeze situation, and then all of a sudden it wakes up because you get so overwhelmed and the pressure, and you get angry, irritable, sleep deprived, all of these things. And let's just say it happens every other week, once a month. And you have a rush of blood clot factors that make a tremendous amount of blood clots. Guess what that can cause, you guys? We've talked about this before. Heart attack and stroke. So do we really have an LDL problem? Or do we have people having heart attacks because we have increased amounts of blood clots being formed? Because we're in chronic fight or flight, because we don't take care of ourselves. We're not sleeping. We're not getting outside. We're under blue lights. We eat crapola. All of these things. It's one big giant connect the dots. And then we lean on these functional medicine people that they're going to look into all of these things and they're going to try to connect the dots. But eventually, they're just going to sell you supplements. Oh, you got a dorsal vagal branch of your nervous system that needs to be. Oh, let's give you something to calm you. Let's take away. And then they'll give you something. Oh, you got a selenium problem. Oh, here's your selenium. You got a copper problem. Here's your copper. I see that your zinc is a little low. It's all just one big giant supplement. You'll hear about creatine being at high doses, 15, 20 grams a day. That'll help your brain function. What's causing your brain not to function? You start out with them because you think, oh, they're going to look at the root cause. But eventually, they're going to get to where they can sell you the supplements. I hear it from you guys all the time. Let's see. Okay, the Tiger Mom says, so take MCT oil, so medium chain triglycerides, which is basically saturated fat, mostly saturated fat, 60-40 saturated fat, okay? Get lots of large muscle exercise. Agree. I would agree that muscle is the organ of longevity, and we need to exercise the large body parts. The largest body part is our glutes, our gluteus maximus, medius, and intermedius, right? So the glutes and the hamstrings and the quads and the latissimus dorsi. So we're going to work the large muscle groups. Got it. Tiger Mom says, I have ADHD, attention deficit hyperactivity disorder. Okay. What is causing that, Tiger Mom? There is a root cause. You have prediabetes. So that means you have elevated blood sugar, right? Or you don't have elevated blood sugar yet, but you have high insulin. So that tells me your diet can be fixed. And that could be causing your short wiring in your brain to cause what you call attention deficit, which is really just brain fog and an inability to focus because you're hypervigilant. So you don't just have ADHD, which is really easy for a doctor just to give you a diagnosis. That's what we do best. We listen to your symptoms. Oh, you have attention deficit hyperactivity, means you're just twirling your thumbs and you can't focus. So you're just sitting here like this. We're very good about giving a diagnosis because we can give you what? Medicine for it. Instead, nobody wants to fix your prediabetes, which we diagnose by an A1C, which is really a late finding. You should have been checking your insulin level. All right. So Tiger Mom did carnivore strict: beef, butter, bacon, eggs, and lost weight. Also taking an SSRI and ADHD medicine. See how it's very easy for the doctor to give you a diagnosis and you take the medicine. Tiger Mom says, I'm an adult and I also take creatine. I follow Dr. Berg and Dr. Ken Berry. Okay. Diagnosed in 3rd grade with ADHD. What was your diet like in 3rd grade? What is your diet like now in your 40s? See what I'm saying? What is the root cause? If you were diagnosed in 3rd grade, what kind of childhood traumas do you got going on? You know? You guys, we have a live fundraiser for rescue, rehab, and rehome. So if you feel touched in your heart to donate $1 or $2 to rescue, rehab, and rehome, it's a local rescue here in central Iowa near Des Moines. And it's who I support. It's where I got Buddy and Tallow. So I would appreciate if you, even if it's $1, they would appreciate it. For those of you who are on YouTube, message me. I will give you that link for rescue, rehab, and rehome, or just go to their website and click on donate. And even if it's $1, it means a lot to them, okay? So I just wanted to take a little break and say that. David says 90% of serotonin is made in the gut. We have Medicare in Australia, no insurance companies here. If you have a concession card, for example, a med that costs $30, very interesting. Time is money. Yeah. Let's see. Yeah, I agree, David. Information is power. So knowledge is power. Educating yourself is what is going to make the biggest difference. David, I think you probably know all the ins and outs. David says you're taught to put things in a nice, tidy bow in med school. So many influences, professors, big pharma, not wanting to go outside the box and not be a part of the cool kids. You're right. It's a clan. But I knew, even as I was going through residency and even medical school, when you go out and do rotations, you start noticing the division between the specialties, and then there's fight. Everybody thinks they're a cool kid. And now in today's medical system, you have these outliers, whether you call them functional medicines or the Dr. Barrys or the Dr. Bergs of the world. They're starting to push back on things that we've been taught. And that's a good thing. Think about it this, whether it's right or it's not right, it's actually getting you to think. It's getting you to go look stuff up. It's using your logical brain, okay? And I always bring this one thing up, and it's on LDL. With all the medicines that we have that lower LDL, you would think that heart attacks would simply not exist. Yet, they're occurring at an alarming rate. So is it really an LDL problem? Or could you have an anger management problem? Could you have trauma? Could you not, maybe you don't sleep well. Maybe you have job stress. Maybe you are that hyper-vigilant, overachiever, empathetic, chronic fight or flight, freeze frame person that activates your dorsal vagal branch of your nervous system and puts the brakes and the foot and the gas pedal on at the same time. And things build up and then you explode. Okay? Quick says, I got to be cut open or something broken before I go to the hospital. So using a doctor only for acute care. Cut my finger off, need it stitched on. Need a new hip replacement. But overall, I truly believe in you guys, and you can read and learn about all of your body systems, physiologic, biologic systems going on in your body, and be able to fix them. It doesn't always take a supplement or a medicine. It takes removal of what is causing your problems. David says, I get surges during sleep, palpitations, flutters, feeling sweaty. I think it's all cortisol related. Is it cortisol related, or is it your brain staying hypervigilant? And there's a difference. When the brain stays hypervigilant, it prevents you from going into deep sleep. When you don't get deep sleep, guess what? You don't get lymphatic flow that gets toxins out of your brain, out of your head. Just like the lymphatic system works on the periphery in our body, the lymphatic system works in our brain. If you do not go into deep sleep, you don't get it. If you have insulin resistance, your lymphatic system sucks. So your brain is sensing emergency while you're trying to sleep. Is cortisol one of the things that could be secreted? Yes. But you have to figure out what is causing that hypervigilant, I can't sleep. Something happened, David, long time ago that prevents you from closing both eyes. You're in, I got to watch for the lion all the time. And when your brain senses an emergency, it's going to cause you to wake up. Your heart's going to race. You're going to sweat. Your body temperature goes up. That is what is happening in a body that's responding to an emergency. But what is your emergency, David? What is it that's causing your brain to think you're in an emergency? Mary says, I feel very wired after my sessions with my physical therapist. Or is it your personal trainer? I don't know. Doing resistance training. How should I calm down? Best methods. Breathing. You need to breathe, Mary. They need to teach you how to breathe during your sessions. When you lift, on the concentric part of the exercise and the eccentric part of the exercise. When do you breathe? Are you holding your breath? Are you out of shape, Mary? Are you simply out of shape? And you're going to breathe heavy, and then your heart rate's going to go up. These are normal physiologic responses. It's not that resistance training caused it. You have deconditioning. All right? And you're not breathing, could be not breathing appropriately. So you're just getting started. Give it some chance. Give it a chance, okay? Maybe it's normal. We got to keep your blood pressure up. Maybe it's normal for your heart to start racing. Who knows, right? Okay. Just a chill guy says, I've had chronic pain and nerve damage for 9 years from an inguinal hernia mesh. Should I try physiotherapy or is neurectomy the only option? I'm not sure. I can't remember which nerve it is, but when we do get inguinal hernia surgery, a lot of times they can't spare that nerve and it will cause a numbness or a tingling on the surface of the skin in that area. It will probably always be there. It feels very odd. Sometimes it can radiate into the groin, in the medial groin, but I'm not sure. You do a neurectomy, you're removing that nerve, and you could be getting other superficial symptoms that you're not bargaining for. So I don't know. I would try non-invasive physiotherapy before I would go in and have something cut. David says creatine can falsely elevate EGFR. Why would that be? Any tips for spinal stenosis? So you've had testing and you have spinal stenosis in what area? Are you exercising? Are you lifting weights? Are you strengthening the area behind it? Around it? Chris says, I won't get statin drugs, I guess. I'll just suffer. Suffer with what, Chris? What are you suffering with? Let us know. Yeah, Ryan, if you think, where did you send the $75? To Rescue, Rehab, and Rehome? I'll let them know. I appreciate that. Gear Jammer says, we didn't have ADHD when I was a kid in the 70s. All that crap wasn't invented yet. Invented or made up, Gear Jammer? Our dad's hand across the back of our head cured all of that crap. Yeah. Chris, what did Chris say? Chris cured restless leg with organic avocados. I did research on my own. It has some natural chemicals in it. Good job. The Kana kid has dementia from martial arts. Any advice? Seeing a neurologist at that point. I don't know. David says, why divide when the whole idea is to help? Specialists should communicate. Should. Do they? No. They don't even communicate with the primary care doctor in most cases. Lots of prestige and money. I would say it's ego. It's ego. They can't let go. They're edging God out. They think that they're their own God. Most high functioning people feel that they deserve certain things in life. More so, they actually think that they're not one of God's image bearers and that they are their own God. This is just from my experience, okay? We all have a little bit of these tendencies because that's what society tells us to do, where we are the makers of our own destiny, but we are all blessed with tools, and I don't believe that we are using the tools to the best of our ability. Some people are educators, teachers. Some people are healers. Some people are financial experts. They've been given tools. They've been blessed with tools by our Creator, God, the Father, the Son, the Holy Spirit, have been given a blessing. Okay? Are we using the tools in our tools box appropriately? Is it for us or is it for others? What we're commissioned to do is to share the gospel and help others. But we, in modern society, help ourselves. Help ourselves. I'm not saying to put yourself on the back burner. I did not say that, because you, in order to be a conduit, must take care of yourself first. And that's how Center Stage came about. Center Stage Primary Care. That is my name of my clinic, my business, Center Stage Primary Care. It is a way that I incorporated my bodybuilding with my medical career. When you are bodybuilding, when you are number one, you are center stage, under the spotlight. There's only one number one, and everybody else is last. You need to take care of you. Put yourself under the spotlight, and once you take care of you, then you are able to take care of others around you. But if you put yourself last, then you can't take care of anybody else, and your health will be declining much more rapidly than the others around you. So that's where Center Stage Primary Care came about, in case you guys are wondering about the name. Let's see. You guys are, okay, lumbar stenosis. We're talking about lumbar stenosis, blocking nerves, L4, L5. That's a pretty common area. Constant pain. Okay, so Dr. Alpha Canine is talking about numbness, constant pain, whole torso, out of whack, but yeah, physio, right? David is talking about lumbar stenosis. Okay. I'm skipping over your guys' comments. I'm looking for questions. If you have a question, just put a Q in front of it so I can pick it out much faster. What are your guys' thoughts on the study on your microbes in your gut and these fatty acids and the gap junctions, the inflammation, the LPS spilling into the bloodstream from the bacteria, causing more inflammation? I mean, it's like, it's fun kind of connecting the dots, isn't it? Where you're starting to connect all these systems, and you wonder where your brain plays a role. Your brain, as you know, is a master organizer, and it's trying to take care of all of the systems, amazingly enough. And we do not take care of our brain. We don't sleep enough. We don't get outside and stay calm. We're all into taking supplements. That's what we're into. Taking supplements, taking medicine, getting a diagnosis from your doctor. It's just, it's amazing. Okay. Looks like you guys have very interesting, but more research needs to be done, but big pharma like to sell the brain candy. I mean, it's possible. John, this is great. You guys got to listen to this. This is when people share experiences with me that almost completely blow my mind. Let's listen to John say this. The cardiologist sent John a message saying that she reviewed my results of the Holter monitor and everything is fine. And John replied back to her how he was still wearing the Holter monitor, never turned in the device. Now I'm guessing that John's device was not Wi-Fi. We have other devices that we use. I don't know if there's a Holter monitor, John, that if yours was hooked up through a Wi-Fi, through Bluetooth, where, for instance, the Merlin A Merlin is, as long as that Merlin is hooked up to Wi-Fi and is close enough to you, it will send in the readings from the monitor, and then the doctor can pull those up and look at them at any time. Was your Holter set up through Wi-Fi? If it was not, that would be an embarrassment for that doctor, saying that everything was fine, or she was looking at somebody else's, which is too bad that she mixed you up with somebody else, because what if your Holter monitor wasn't? But usually we take that Holter monitor off, we take that monitor off, and then you have to send it back or deliver it back to the cardiologist, and then they read it. So I'm not sure, John, that is an unfortunate thing, but I'm guessing she just got you mixed up with somebody else. Caleb says, take your food as medicine, or later in life, medicine will be your food. I agree, Caleb. And David agrees with you. Oh, it's not Wi-Fi. So, John, that's really unfortunate, isn't it? That your doctor mixed you up with somebody else, or was just going through the motions. And that would be, in order to get paid, and we sign off on the Holter monitor, the amount of, I would be scared. I would have fear. For instance, let me give you an example. When I was in practice and I would have labs sent to me, I would, when there's a lot coming in, you as a doctor go through basically the reference ranges and you look for flags. Is there an H, a bold H, meaning high, or a bold L, meaning low? If there was, I would look at the results. That would cue me in to go look at them. And then I'd say, is that really high or is that really low? Can they go on? Sign my name, on you go. That is what's happening when you are seeing 40, 50 patients a day, okay? And now that I know about reference ranges and how they are averages of the sick people who come into the lab, and I'm learning how to read labs. I'm learning about high ELK phos, low ELK phos. I'm looking at functional optimal levels, not reference ranges anymore. But John, that is the what's going on, is they're not looking. It is superficial. That is why you need an advocate. Your parents need advocates. You need to take care of yourself. You cannot rely on your doctor. You just can't. I can't rely on my doctor. I have to help her out. Is it because I think she's dumb? No. Is it because I think she's overwhelmed and she's not looking at the things I'm looking at? Yes. She's a very intelligent lady. She's just not using every piece of her brain all of the time. Do we all do that? No. But that's why I spend so much time on you guys' labs, because I don't want to miss anything. And I'm going to say, yeah, but what about that protein level? What about that albumin to globulin level, that ratio? The globulin's a little high, the albumin's a little low. What is that going to tell me? What if the albumin was a little high and the globulin was a little low, but the protein looks fine because they balance themselves out? Because albumin plus globulin equals total protein. We'll look at the total protein and say, it looks normal. Who cares about the little differences in here? Well, your body does. And your body's telling you something. And it's these intricate little things that we don't look at. If somebody says, oh, your ALT is 25, I'm fine. I say, my in-liver enzymes are fine. No, they're not. A 25 is not normal. A 10 is, a 15 might be, but a 25, no. That's a flag that tells me something's going on. When your ratio of ALT and your AST gets skewed one way or the other, that's a red flag. I got to look into it. And then I write back and I ask you questions. Hey, do you take Tylenol? Hey, are you a drinker? Do you take any other medicines? So you can either let me know with honesty or not. But it's your labs that I'm reading, and I'll say, there's a little discrepancy. It looks like this. Whether you admit it to me or not, that's up to you. I'm the one here trying to help you. Okay? If I think that you have a liver problem, I'm going to start scanning and asking you questions. What's going on? What is your diet like? Do you exercise? What is your exercise? Are you around smokers, drinkers? What's your stress like? How much do you sleep? Do you get outside? What other supplements are you on that you didn't mention with me? There's a lot. David says when you're in your 40s, you can't get away with the food like you're in your 20s. Well, the reason you are in your 40s and are having problems is because of what you did when you were in your 20s. And you just let it go. We all did it. I did it. I ate crapola, and the amount of calorie deprivation that I did to myself eating so I don't get fat. I'm a girl with body image just like any other girl in high school. Guys don't have that as much. Girls want to be pretty and skinny. And there was not fat people when I was in high school or junior high. It was very, very rare. Okay. And I'll tell you, when you found an obese person in school, you looked at them differently. Okay. Now you might look at them differently, but it's like every other person. It's 50% of the population. Not when I was growing up. And skinny was in. And calorie deprivation was in. Is that an eating disorder for the most part? Yep. It is. It's a body image distortion. So it's amazing that, our body is able to recover from that. But David, once you reach your 40s, you're living the 20s, how you treated your body back in that time. And we didn't know. I was not educated to know that cereal was bad for you. The bran flakes, I knew not to eat Tony's Frosted Flakes. But what about just plain corn flakes? Corn, flake, processed, seed oils, carbs, insulin resistance. Nobody taught me any of that stuff. It wasn't even a thing. But now, modern medicine, we don't have an excuse to not know these things. Caleb has lost 100 pounds and feels so much better. You guys, who doesn't have an extra 100 pounds they would love to lose? What did Caleb do to lose 100 pounds? Hops asked, how important is stretching in getting back into shape? And I hear a lot about peptides. What are they for? One, I think you should put the peptides on the back burner for right now, okay? We need to change our diet from processed foods, seed oils, and sugars. Lean on whole foods, okay? Lean on whole foods. Getting back in shape is going to require resistance training as a core foundation to your exercise routine. Walking in nature, getting outside, is a core foundation of life, being outside. Is stretching important? You want flexibility as you age. So how important is stretching? Absolutely important. However, how are you going to stretch? Are you going to do dynamic stretching or static stretching? Which is better? Should you do both? I am under the impression that we should not only static stretch a warm muscle after we get done, but we should do dynamic stretching to warm us up. So yes, I think it's very important, and most trainers teach this for the most part. Again, I'm painting a broad brushstroke. Just a chillin' guy says, healthcare in Canada is brutal. I have problems. I know I won't even be properly addressed. That's why you have to be your own doctor. Just a chill guy. David says, I unintentionally lost 30 kilos due to reflux and anti-candida diet. You know what? I know I hear that the Canadian healthcare system is bad, but who ranks number one in the amount of money spent? Maybe in the top, that our gross domestic product, our GDP, is spent on healthcare, and see how that is going for us. David says, as a doctor, how do you remember all patients, tests, scans, etc.? My new doctor is like on the ball, but takes calls, types up notes, writes scripts, but remembers 80% of what I tell him. It's a picture in our brain, David, or let me just speak for myself. I form a picture in my brain. And when I associate David, I might associate David with, let's just say David has an aortic aneurysm, okay? Yes, they're rare, and I don't have very many patients with them, but whenever I see the picture of David, I think about an aortic aneurysm. And so that's the first thing that will come to my mind. And then I'll think about aortic aneurysms. Okay, is that a diabetic? Is that a high cholesterol patient? Is that a prostate patient? We have these associations that we have learned to do in our brain, where our brain is constantly being triggered. And it just takes one thing to remember David for, okay? I might forget David's name. And another thing, this is another thing that I associate. I might associate David with a family member that he told me about. And when I associate David, I think about his dad's motorcycle that he was telling me about. And then that triggers me to remember that David has the aortic aneurysm. It sometimes is no rhyme or reason. And that 80%, you give us kudos and you say, how do you remember that? I'm not sure. I could have a patient whose job is to do flowers at weddings. And that person, I will remember that they do flowers at weddings, and it will remind me that they have diabetes that is well controlled on 500 milligrams of metformin. I might see that patient twice a year. I don't know how we do it, but it is something that our brain naturally does. And yeah, there are some people who don't have that, obviously, and they can't remember anything. Now, I will admit, I love when a patient reminds me of their medical history. So when I come in and I'll say, how's things going? Let me know. Tell me about your medical history. Tell me about all of the diagnosis I've given you. I love when they tell me, okay? I did not bring a computer into the room. I brought a piece of paper. It did have your diagnosis and your allergies and your meds and all of that. Did I use it? No, not unless I needed to take a note, because I wanted you guys to tell me. That is recall and repeat. That means you heard what I have said and you can recall and repeat it back to me. Maybe it's not completely perfect, but you are able to recall what you've been diagnosed with and why you're on a medication. Why are you on a statin? Well, I don't have high cholesterol. It can't be that, but I have diabetes. You told me that all diabetics routinely need to be on, according to insurance and whoever the powers that be says that all diabetics need to be on a statin. Why? Your guess is as good as mine, but it's a requirement. If all diabetics are on a statin, then you get reimbursed. Doctor gets reimbursed. Doctor follows the rules, is obedient little robot. You don't even know why. You just know that you have diabetes and you require being on a statin. Statins actually worsen diabetes. The things that statins do is, yeah, they lower LDL, but is that the problem? But they're antithrombotic. A component of them is anti-blood clot. A part of them is anti-inflammatory, blocks inflammation. But it didn't stop your diabetes. Your diet stops the diabetes. Oh, I'm on metformin. Well, that didn't stop your diabetes. That's band-aiding over your diabetes. Metformin just drives blood sugar into a cell. Well, why didn't it just do it on its own? Because the cell was full. The cell didn't want anymore, so it closed its doors. So the doctor gave metformin to forcefully open the doors, to push more into the cell. And then the cell will just explode. It gets so full like a balloon. It's going to pop. And so then it starts leaking out more inflammatory cytokines and interleukins and all of that. So we didn't do anything to help you. We actually kind of made it worse. I got off track, didn't I, on how doctors can remember all these things. Hop says, how do you best advocate what the exact problems are, especially if you're not that knowledgeable? And would journaling help the doctors and nurses? Well, speaking for myself, a doctor, I like when patients journal and take notes. But I'm actually going to go the extra mile and plug those journaling into your chart and start connecting the dots. If you don't give us enough information, Hops, we are going to go and treat you like an algorithm, like a general recipe, and check the boxes. We're going to make a diagnosis, and we're going to give you a medicine, and we're going to pat you on the back, pat me on the back, and we're going to move on and say, I'll see you in 6 months, or let me know if you need anything. That's how it works. So even if you gave them the answer, gave them all of your journaling, they still might not be able to connect the boxes because all they're thinking about is a recipe. They can't get themselves to look outside. It's like they got blinders on. So yes, it helps. Again, I'm painting a broad brushstroke. There are going to be other doctors who are like me, who don't see very many patients in a day, who are locked in on every single one of your symptoms and getting you to talk. What is going on? What's going on at home? What's going on at work? How did it go driving over here? That can tell me a lot about your mental well-being, is you tell me about the drive over to the office. Tells me how you're handling things, tells me about your behavior, your attitude, all kinds of stuff. Then I can ask questions, but the doctors now got their hand, well, even back in the day, they got their hand on the door handle at the same time they're saying, and this is the one thing is, says, well, as long as you don't have any other questions, I'm going to get going. I got another patient to see. And then what we hated was the by the ways, OBTW. Oh, by the way, and then the doctor would naturally say, hey, go ahead and make another appointment. I don't have time for that. Oh, by the ways. No doctor likes the by the ways. John says, my AST was 10, ALT is 13. Looks good, bud. Just the chilling guy. Thank you. Hey, guys, I appreciate you guys. If you could hit the thumbs up, you guys. Let's try to get up to 45. We have 32. Can everybody who's listening right now hit the thumbs up? I would appreciate it. David says, don't get me started on the liver enzymes. My gastro put me on antibiotics that gave me high ALT and said it's fine. Just got my enzymes under control a few months ago. Good job. What were you being treated for? Gastro put you on antibiotics, but what for? Thank you guys for all of that over there on Instagram. I appreciate it. Well, just a chillin' guy, You don't have 100 pounds to lose. Somebody else might have an extra 100 pounds that they need to lose. So no, some people, I would not want to lose 100 pounds. I would die. Okay? Yes, you should stretch every day. Chillin' guy. David was put on 6 antibiotics for 5.5 weeks for diverticulitis. Itis means inflammation, correct? What was David doing? He doesn't just get diverticulitis out of the blue. He doesn't even get diverticular disease out of the blue. Something caused it. Refined foods, processed refined foods, seed oils, polyunsaturated fatty acids, sugar causes and leads to diverticular disease. And then those diverticuli can get inflamed. They can get debris from food stuck inside. One other reason to avoid plants. Okay. Patty says, I'm in my early 50s. I started to realize that drinking and the sugars and alcohol was making me insulin resistant. Sweets too, but drinking on the weekends make me feel dysfunctional. Yep, it was poisoning your liver. It was poisoning your brain. Alcohol is a toxin, and you tolerate it until you don't. Hop says, with videos on our phones, now we should probably record medical visits, especially what the doctor is saying. So what do you mean? I mean, you're gonna record them saying, I don't know? I'm not sure how that's gonna help you. Patty says, my endocrinologist gave me metformin for insulin resistance. It made me sick. Probably GI upset and diarrhea. I stopped eating any sugar, cut out alcohol 10 years ago. Congratulations, that's awesome. Let's see, Just a Chill Guy says, if someone is under 30, early type 2 diabetes, fairly average weight, I don't know what that is, guy, girl, what's the average weight? Today it's obese. That's the average weight is obese. Something like metformin necessary. Nothing's ever necessary for remission. Metformin does not cause remission of anything. There's no medicine that causes remission. Stopping the poison, which is sugar, processed foods, seed oils, is the cure, the remission. For you. Devin says, how do you slow OA, osteoarthritis? What caused the OA? And then slow it down. Stop whatever is causing the OA. Yeah, John, medicines can raise ALT and AST. You're exactly right. David says, do you start to resent medicine after all these years, or are you still passionate? Many get compassion fatigue. That's true. And that might be why I started doing, a year and a half ago, I closed my practice. A year and a half ago, I went completely online. A year and a half ago, I might have been in that I resent medicine. Is it medicine that I resent? Or is it the insurance companies? Is it because I was out of the matrix and my eyes were open and I was seeing what is actually going on in this world and healthcare? Maybe that is it. When I look at people going to medical school and I look at the indoctrination that is occurring and their egos, it is no different. Okay? In fact, when I was going to medical school, there were more empathetic people than there are now, okay? And some of those empathetic people turned into raging monsters. And I thought, I better get out now. I didn't think that. If it wasn't for my nurse wanting to retire, I probably would still be what David would say, resenting medicine. It's resenting the insurance companies and the pay and the patients being taught wrong things. But you guys are different. When it's online, you already know what my path is, what my deal is. You already know. And so you're not going to come to me and say, doctor, I want you to read my labs, but I'm not gonna exercise, and I'm not gonna stop eating fruit, and I'm not gonna stop eating candy. I'm a sugaraholic. I just need it. And there's not much I can do about my sleep. That is not you guys. You guys genuinely want me to tell them what your labs say because no one else has told you. You feel crappy. You've been to 15 doctors and you just can't figure it out. And the 15 doctors couldn't get you to connect the dots because your brain was in a paralysis. You couldn't connect the dots. Even if they gave you a little bit of information here and a little bit of information and 15 little pieces of information, you couldn't connect the dots. They could have all been right, but nobody fixed your problem. I'm tired. But you couldn't get all of the dots. What I try to do, connect the dots. Okay? For those of you who have had me review your labs, I ask further questions. I'll be sending emails. Did you say that you sleep good, don't sleep good? Are you a stressed out person? What is your role at work? What is your exercise routine? Well, I told you, doctor, I go for walks. Do you go for walks on a treadmill? Do you go for walks outside? How often do you do that? Do you do it when the sun comes up, when the sun goes down? What are you doing? When is your last meal of the day? When is your first meal of the day? Do you go to bed from midnight to 10 a.m. or do you go to bed from 10 a.m. or 10 p.m. to 6 a.m.? All of these things matter. Nobody's connecting the dots. But David, to answer your question, I like what I do. God has blessed me with the ability to teach and to teach health. I might be wrong. I will admit I might be wrong. But my hopes are I can get you to open up your brain and think logically and stop being fed like a robot. I don't want you to be a robot. I want you to use your brain. You are given a brain for a reason. Okay? You might not get it all. You might be better at finances than you are at your health. But it just takes a little bit of information to hear me say, I was thinking that this and this. And you go, oh my gosh, doctor, you're absolutely right. I did do this, blah, blah, blah. I didn't even connect those two things. Exactly. That's why we talk. Just a Chill Guy says, I asked this before, don't know if you saw it, but can you comment on the COVID vaccine? How about you ask me a question and I'll try to answer it? Commenting on it is like, yeah, it's an open-ended question and I don't know. And Jimbo, I don't know the answer to your pulmonologist question. John says, do you think medical field has taken long COVID seriously? Hold on, just do you think the medical field has taken it seriously? Met so many like myself who were healthy and no underlying conditions, and then after having COVID are struggling with severe fatigue and so on. I think long COVID in the thought process of a doctor is the same as, I'm going to give you an analogy. John, when a patient comes to a doctor and they're on a statin and the patient says, I just have terrible muscle aches and pains. I can't go on. I've read it's the statin. And the doctor poo-poos you and says, live with it. It's saving your life. I doubt you're having muscle pains like you say. You're probably just getting older. You're probably whatever it is, but it's surely not the statin. Okay? The analogy to long COVID is, yeah, COVID's a cold and you got it and it's gone. And I don't know what you're experiencing, but I don't know this long COVID thing, if that's a thing. But yet you have listened to other outside the modern medical world, and you say, yeah, there is such a thing as this long COVID, and it is causing problems. But again, it's not just the COVID. It's COVID plus bad diet. It's COVID plus bad sleep. It's COVID plus stress. It's a compounding, but of and by itself, I'm not sure. Could it have triggered a whole bunch of other things downstream? Absolutely. But doctors are just going to say, oh, you're struggling with severe fatigue? Well, get some sleep. How about we set you up for a sleep study? Oh, you got a little bit of sleep? That's probably the cause. There's no thinking going on. So to answer your question, do they think seriously of it, John? No, I don't think so. David says, this is a great conversation. I'm just going to slip this before I get to David's question. I want to slip in a question from Mary. Any tips on good sleep hygiene? I would say, when is the last meal eaten? You need 2-3 hours of digestion. Are you going to bed when it gets dark? Are you getting up when it gets light? Is your room cool? Do you have all TVs off? Do you have no phone, video, iPad, TV off 2 hours prior to going to bed? Do you exercise at night? That's a no-no. All of these things, Mary, are tips to sleep good, okay? And a lot of times we don't want to do any of those, okay? Abhik is listening from India. Welcome. Thank you for being here. Okay, Cynthia, we're going to answer David's question, then we'll get to your question. What turns empathetic doctors to monsters? To be perfectly honest, David, I'm not even, it could be burnout, but I would venture to even ask, and maybe I said the wrong thing earlier. Was the empathy a fake empathy in the very beginning, and you're seeing their true self now? Because a lot of times a doctor can mimic what empathy looks like. It's your mirror imaging what empathy looks like, and you have absolutely none yourself. So they absolutely were the monster from the very start. It's just that they were better at masking the mirroring. Everything you wanted to hear. Everything a medical school wants to hear in a person applying for medical school. Maybe they were never empathetic. Just a Chill Guy says, do you think COVID vaccine causes blood clots? Absolutely. I think everybody knows that. Even doctors. Because COVID hit through the ACE pathway. It actually works inside the cell, not outside the cell. So you have to think about the clotting factors and this ACE pathway. In fact, people who are on ACE inhibitors were actually safer than those not on an ACE inhibitor. So there's a lot of nuances, and you can't tell me that the medical society does not know that blood clots are more prone in the COVID vaccine. That's how they worked. And the medications work exactly the same. Is the medication working inside the cell or outside the cell? And where does the replication take place? Inside the cell, outside the cell? Those are all good questions. But, whether it's my opinion or not, the medical society, medical establishment, modern medicine, the medical system knew this in 2019, in 2020. They just never capitalized on it. Like, okay, well, what's that going to tell you? Okay, it causes blood clots. Well, so what? It's just what it does. That's what it does. Okay. And the vaccines and the medications, well, how are you going to explain that? It's almost like the information was there and, you don't use it. Hop says, would more people in the medical field help with the current stress? I think eventually it's not going to be a human thing. It's going to be an AI thing. Okay? It's wherever you can make money, Hops. They can make more money, not on doctors, but on ancillary personnel. They make more money on nurse practitioners and PAs. Why? Because they can pay them less and charge the same amount. They don't care if you have doctors. And you guys are getting so used to seeing PAs and nurse practitioners, you're not going to stand up and say. And to be perfectly honest, some of the nurse practitioners I have known are much, much more brilliant than some of the doctors I know. Okay? So, again, it has nothing to do with the letters behind their name. It has everything to do with their ability to take information and use their brain. It is what it is. We can fake it all you like, but people are going to start figuring it out. Will it help with the stress? I think the medical field has the highest suicide rate of any professional. And I don't know why that is. One, it's very easy because doctors are so good at making snap decisions that if it gets in their head about suicide, they actually commit it because they make a rapid decision. Whereas some people will kind of contemplate and think it out and think of the pros and cons first. Like, what's this going to do? Not a doctor. They think it gets in their head, they make a rash decision, and bam. Because they're so used to making decisions quickly, rapidly. So they complete the task. We are responsible for other people's lives on a daily basis. We're responsible not only for the lives, but we're responsible for us. Our whole life is centered around a license with our name on it and a certification. And with our egos, if we lose our license or we jeopardize our license, our namesake, it doesn't really relate to you as a patient. It relates to us and our inability to satisfy ourselves. We get guilt and shame and bam. Okay? So can you change that by simply just adding more medical people into the field? I'm not sure. We've never done it. We try. We can't do it. Medical schools are closing down, not opening up. Just a chill guy says 2 hours screens off before bed is a wild. Yeah, it's wild, but it would probably improve your sleep. Oof. Live with Meteor Random Live with Meaty. Yeah, whatever. Yeah, my dad had a bunch of strokes, 5 shots. Yikes. Cynthia asks, what do you recommend to decrease ApoB down from 113? What's wrong with 113? And your other markers are good, Cynthia? What other markers? And what is good? By definition, is your good in the reference range? And what is ApoB? ApoB is a protein on an LDL, a VLDL, an IDL, and LP little a, which one of your LDL, VLDL, IDL, LP little a, which one is the highest? ApoB is a number. It doesn't tell you what particle is actually raising ApoB and who decides what normal ApoB is. Is it the same people that make the statins, that make the cholesterol medicines? Is it the doctors that are following the standard of care and saying, I want an ApoB less than 100? Who even came up with that? Is it working? Are people dying of less of heart attacks with an ApoB of 112 or 90 versus 150? Look at your markers. Is your VLDL high? Is your triglyceride level over 70 and your HDL less than 70? Yeah, you are at risk. How do you lower that fraction to lower your ApoB? Stop eating carbs. Stop eating the sugar and the processed foods and the seed oils. That will lower your ApoB. Just like that. What part of it? That's why it gets me that they're not going to look at LDLs anymore. We're going to just look at ApoB. If your ApoB is over 100, you're the problem. That's the problem. Here's your statin. Here's your cholesterol-lowering medication. How's that going for people? Is it stopping any heart attacks? Vicky says, how bad is smoking? It's bad. There's too much on social media about nicotine being good, and my younger son believes smoking is good for him. No, the nicotine and smoking are two different things. The chemicals in tobacco is a problem. Is the nicotine a problem? Maybe not. I don't know. The things on social media is not saying, let's smoke to get your nicotine. No, it's saying, take the nicotine. Your son or whoever hears, ooh, nicotine's good for me. I think I'll smoke. Wrong. Lucky Life says, hi, Doc. I hope you had a great week. What are your thoughts on stress that everyone deals with in different ways? What do you do for stress relief? What do I do? Personally, what do I do for stress relief? I sleep. I like to sleep. I like to exercise. I especially now get out every single day in the sun. I take several walks a day. I hold my dogs. I do normal things. I try to stay off. I've been really much better at this, is staying off my phone. I used to go and answer everybody's questions on social media. That if I did a reel, I would go back and try to answer everybody's question to the best of my ability. And I thought about all of the stress that was bringing to me. So I stopped. I'll do an occasional one. I'll do it if it pops up. But instead of just keep asking me questions, go look it up. We have the same access to the internet. And then if you still can't get it, then we all talk about it. But that was part of my, you don't want to get rid of stress. It keeps you on your toes for the most part. It's chronic over an inability to relax and rest. It's an inability to use the parasympathetic nervous system. Most people stressed are hypersympathetic system. That is your fight or flight system. So yeah, I could tell you to reduce stress, calm yourself. I would say, go for a walk. Well, it works okay while I'm doing it, but then after, that tells me that you have no ability to raise your parasympathetic nervous system. Parasympathetic is calm and digest and rest. You're never allowing yourself parasympathetic tone. You are that person I talked to early on that is, they have an overwhelmed nervous system for years. And then the brain shuts down. It says, well, there's no real reason or no way I can run away or fight back. So I'm just going to shut everything down. So you go into a paralysis, into a procrastination, into a high functioning freeze until all of the tasks pile up. If the tasks pile up, then you explode. And you have toxic adrenaline. This is where heart attacks occur. Toxic adrenaline and the blood clots from the anger and the stress and the this and the that. Okay? So, yeah, it's tough, but talk therapy, hanging around positive people, turning off the TVs, not listening to news. I mean, a lot of thumbs up. Thank you, guys. I appreciate it. Penny says, how do you feel about colonoscopies? Are the at-home tests okay? What are they at-home tests testing for? You mean like for blood, like a fit test? They send you what tests? I don't know. It's a scary proposition. So I can give you some experience. There's a gentleman that I knew who never had a colonoscopy. And he ended up with colon cancer probably in his early 60s. And he had a colon cancer that was not found in a normal place. Usually the colon cancers are found on the left side of your colon. So the rectal area, the sigmoid, the ascending, and sometimes the transverse. But the least amount of cancers are found in the descending colon. And that's where his was. And sometimes in that descending colon, we're not going to have any symptoms. And this is a guy that he might not have smoked or drank, but he didn't really exercise. He just ate whatever. He was that skinny fat. He kind of had a little bit of a dad bod with the big belly, but he wasn't like obese. He just had this little belly pooch thing, and he loved life. And I'll tell you what, his colon cancer had grown exponentially because it is found on the other side. It didn't have symptoms, and it was quite large and had spread and metastasized before he knew it. I don't know the answer. Is there real problems with inserting? You can't clean the scopes the way you jump up. I'm not leaning over. You do it, buddy. Buddy wants up, buddy wanted down, and now buddy wants up. Isn't that what dogs do? So I give him a little bit of room. You jump up. You can hear him. He's talking. Why don't you pick me up? That's what he said. Jump. This is how we give in. This is parents. Come here. No. See, he's going to run away. Okay, so you can't clean the things. Could you insert bacteria from a previous person into you? Yes. Can you poke a hole? Absolutely. You're trusting. Okay. He would just have sit there and talked. Say hi to everybody. Buddy, say hi to everybody. Not just me. Say hi to everybody. Give everybody love. There you go. Good boy. All right. So, Penny, I don't know what to say. Have you had one before? Maybe you get a one and done. Maybe you get one and you look for polyps, you look for diverticuli, you look for these things, and then you work on them and call it good. I just don't know the answer. Beefy B says, how would you address endometriosis and resolving it? Well, I would address it first with diet and exercise. Okay? That's what I would do. Lisa says, is an ALT and AST in the 25 to 30 correlated to high ApoB of 140? Well, what I will tell you is an ALT and an AST tells me that your liver is not functioning correctly. If your liver receptors on the hepatocytes are shut down, diminished, not accepting LDLs, will LDL, VLDL, IDL all go up? Yes. If less is circulating back to the home base, which is the liver, then the result is more particles in the blood. those particles I just mentioned, LDL, VLDL, IDL, LP little a, all have an ApoB. And all ApoB can go up. So, Lisa, your problem is in the liver. What is wrong with your liver? Got to look at other things. Get a GGT. What's your ELK phos? What's your diet? What's your sleep like? What's your exercise routine? Garnis asks, slime mold can affect your health. Do you see patients regarding slime mold? No. How do you treat it? I do not know. That's Tootsie in the background. I don't know what she's talking about. Mary says, I'm guilty. I use the iPad until bedtime, watching YouTube videos. We'll stop this, may improve my sleep. Good for you. Awesome. Let us know. Cynthia's in ketosis weekly. Okay. I'm not, again, on Cynthia, with something like this, I probably would schedule a consultation. If you want me to go over your labs, just email me at ironladydoc@aol.com and I'll get the forms to you. And you can decide whether or not you want me to look at your stuff. Vicky says, what do you think about chiropractors working on spine that has degenerative discs and spurs from overworking and injuries at work? How does it make you feel when you get done with your chiropractor? Are they gentle? Are they explaining that you have a lot of degenerative discs and spurs and I'm going to give you some room to breathe? I'm going to give your spine some room to breathe. I'm going to teach you that your muscles are out of balance. I'm going to tell you that you are compensating. That's what a chiropractor, a good chiropractor will do. They're going to perform some procedures, but they're going to tell you, here's what you're doing that's causing your imbalances. So I'm not going to hurt you by treating you. You're hurting yourself by not removing what the problem is in the first place. Okay? And a good chiropractor will say, you really have an imbalance here between your hamstrings and your quadriceps. If you can go to a trainer, start working these, do some leg, some quad lifts. I mean, whatever the treatment is. But yeah, I mean, think about it this way. I'm a DO. I was taught manipulative medicine, similar to what a chiropractor does, okay? Now, do we go in, if this is crazy, but the OMM doctor who does OMT, osteopathic manipulative therapy, do you think that they're going into all these questions about your history, or do they come feel, oh, you got your ASIS is anterior, it's anterior inferior on the right. And they're going to crack you back in and put your ASIS back into equality. Whereas a chiropractor will say, you know what? I noticed that your glutes you're starting to get flat butt syndrome. And your medial quads are really weak. I can tell the way you walk. Well, then I would say, I think that chiropractor's given me a little bit more information about my imbalances than the OMT doc. I don't do OMT anymore. I stopped when I went into residency. Now, granted, I did an MD residency and MD boards. Yes, I went to osteopathic medical school. I learned OMT, but I didn't do it when I got out. I never got training when I went to an MD residency. That all ended. And then I did MD boards. They're not testing over OMT. So hopefully you found a good chiropractor. Yeah, sweet doggy. Most of the time he's sweet. Okay. Yeah, it could be robots taking care of us. And you're probably right. There was more nurses taking care of everybody at the end in 2023-ish. right? Can you imagine something lasting for 4 years and nobody knowing anything about it? Just so happens they know nothing about it when all of this developed probably in the 70s. Darnus, I can't answer that question. I don't know what it is about your system that's allergic to shellfish. Yeah, that could be right about EMTs and the burnout. I never thought about it. So they could be a higher risk than even a doctor. Thanks, J Dizzy. I appreciate that. Okay. I'm looking for questions. I'm skipping through all of your comments, you guys, because there's a lot of them. Just a chill guy, how bad are energy drinks? Well, if you have a person that, if you're a person who's already hypervigilant, caffeine and all of the B vitamins and all of those things are doing you a disservice. They're making things worse. Sugar-free, not sugar-free. I mean, I'm glad they're sugar-free, but it's all synthetic. James says, my Nan smokes. She lived into her 80s. Awesome. Maybe she could have lived to 100. That might be the way to go, is to say no to vape or whatever it is. Let's see. Share market savvy says creatinine is 1.26. What should I do? I would need to look at everything else. Consider doing a consultation. Email me at ironladydoc@aol.com. Iron, IRONLADYDOC @aol.com. Okay. Norman Talo's actually, he's actually in the garage, right? You know what? He's in the office. He's in my office. He goes in there to be alone from all of the riffraff that's making noises. Share market says, what you say about nowadays CKD, more patients? I don't know what your question is. Sorry. CKD, chronic kidney disease. SR7 says, love you, buddy. He says, thank you. Hops, you have a great rest of your day as well. Thanks for being here. Oh, geez. Yeah, if you're having a low protein, low sodium problem, you need to look to your kidneys, okay? Look to your kidneys. Oh, boy. It's okay, just a chill guy. Hitting me with a flurry of questions here, but is vaping actually worse than smoking? It just depends on what chemicals. There's so many chemicals in tobacco and the cigarettes, and I agree that there's so much. It's just neither one of them are good. They just probably have their own poisons. What is the worst specialist to deal with? That's a good question. I think from my standpoint right now, it would be an endocrinologist. I just think that they've fell off the turnip truck and hit their head. So anyway, maybe not all endocrinologists, but that's one of my common sayings is when somebody tries to buffalo me, I'll say to myself, do they think that I fell off the turnip truck yesterday and bumped my head? Because that's what they act like, as if I fell off the turnip truck and hit my head. Anyway, all right, you guys. I think that is, oh, Mary's got one more. Any thoughts about adrenal cocktails? I don't know what you mean. Tell me what an adrenal cocktail is. I find that they help me feel alert, well-balanced, probably electrolytes, salt, potassium. So you have to ask yourself, why is it that you're low on those things and you need a cocktail? Vanessa says, my ApoB doesn't match my LDL level. LDL 140, ApoB 102, LP little a 10. Doctors want me on a statin because of your LDL. So they go back and forth. It might be LDL for you, but ApoB for somebody else. Again, I don't know what your trigs are, triglycerides. I don't know what your HDL is. I don't know what your insulin is. I don't know what your HSCRP is. I don't know what your MPO is. I don't know a lot of, what is your thyroid doing? Your thyroid might be underfunctioning and you have a lot of LDLs. I don't know. What is your TSH, your free T3, your free T4, your reverse T3? What's your TG and TPO? I just don't know. There's so much that I would need to ask you, and that's why I do consults, okay? But yeah, okay. You're very welcome, Shirley. Thank you for being here. And thanks for the gift. Somebody sent me a dog bone super sticker, so I appreciate that. Yeah, David, I agree. It's hard to give medical advice without all of the labs. And I'm very particular when you guys write me and say, what labs do you want? I'm very particular because I don't want to review your labs and then I'll say, this is what happens all the time. And most people I make aware of that is you'll send me your labs and I'll say, man, you're missing a lot of labs that I could really use to make a good analysis. And they'll say, well, just let me know and I'll get those labs. Well, that's fine, but you have to make another appointment, try to get your doctor to do that or order them on your own, and then we meet again. So it's just a process, you guys. Some people want their labs all done right away. They want all 100 markers or whatever it is, and that's all great. So it's however you guys want to proceed. Maybe you have just a few labs and you want my input on those, and then I'll say, but if you had a CRP and an PLA2, if you had an MPO, if you had this insulin level, if you had all these things, I could make even better decisions. Okay, doc, well, I'll look into getting those and then I'll think about making another appointment. That's fine. Some people say, I want everything right now so you can go over the whole 9 yards. Great too. Thank you. You guys did awesome with the thumbs up. We got to 55. Excellent. That's what I really needed. So that helps the channel keep going. Let's see. We'll do one more here. Vanessa says, how far back labs should we give you for the consult? Honestly, you guys, a year, a couple years, whatever. Really what I want you guys to know is what is happening with you right now. What's going on with you right now? I can see a lot by your labs. If you gave me a CAC score, that's going to tell me what your diet has been like for the last 10 years, 15 years. Plaque grows slowly, okay? So you get me a calcium score, and I go, yeah, your lifestyle has probably not been good for 10 years. That's why you have plaquing, all right? But looking at your labs right now, people need to know right now, what do I need to change? What are you seeing right now? If I see that you've been taking the last 6 months, taking a bunch of Tylenol and your ALT and your AST are off, I'm going to say, what were you like before? Oh, your ALT was 10 and your AST was 11, 12. You know, it must be the Tylenol. That's how I look at old labs. I'm going to put all of your labs that you give me into a table, and I'll label them in columns. Like this is October 2023. This is April 2026. This is wherever that I'm going to try to put those all in a table. If there's so many labs that you gave me, the tables are going to be split up. I can't get them to line up all the way across. The pages aren't wide enough, okay? So I might split it up 2020 to 2023 and then 2023 to 2026, however labs you give me. But most of you guys are sending me your here and now, your functional health, your labs that you got from me. Like you'll email me and say, I need a list of all of the pertinent labs. I send them to you. You get as many as you can, and you want to know what is going on with me right now. Would you have a list of recommended labs? Email me, ironladydoc@aol.com, and I'll send you a list. Doesn't cost you anything, okay? Won't cost you anything. And that would help. And then you say, okay, once I get these back, then I'm going to notify Dr. Jensen. I'm going to sign her forms and do what her policy requires. And then I'm going to let her do her thing, and then we're going to meet about it. Or I want to formulate questions, and I want to ask her all of these pertinent questions that have been burning up inside of me. Vicki, GLP meds and thoughts. We can talk about this tomorrow, but have a question in line. Like, what are my thoughts on what? Why do you need here's my instant thought. Why do you need a GLP? Are you telling me that you don't have enough GLP in your gut? And why don't you have enough GLP in your gut? Why do you need a GLP? Well, I'm diabetic. Well, why are you diabetic? Well, I'm obese. Well, why are you obese? Do you have a deficiency of GLPs? Do you have a deficiency of a little pen that shoots into your belly? Or do you have an excess of something else causing you not to have enough GLP? We don't have deficiencies of statins. We don't have deficiencies of GLPs, unless, of course, you're obese. Obese diabetics have less GLP. Do you just go take a GLP? Maybe. But if that's the answer for the rest of your life and you're going to continue your lifestyle, then I guess you're going to need to be shucking out the bucks. Each time something else comes up, you're going to be the one in line taking the pharmaceutical. Yeah, it's getting used by everybody. It's indoctrination. It's cognitive dissonance. It's everything. It's fear of missing out. The FOMO, or whatever they call it. You guys, everybody, they are appealing to your brain, your human nature. Well, if they're taking it, I'm going to take it. And you're just all going to die together. That's how COVID started, okay? Well, if they got it, I'm going to get it. And we can't go to work without it. And you can't do this look at all the brainwashing that they did to you. They actually told you that if you stood 6 feet away from somebody else, you would naturally be safe. If you stand up, you have to put your mask on. But if you sit down at your table, you could take the mask off, as if there's a cutoff line. It must be about, I'd say 4 feet in the air. It doesn't come down any lower. So if I crawled on the floor, I don't need a mask. I mean, do you think about the things? Well, you got little dots on there? Don't get too close. There's one-way aisles. One way. This is how much they feared you into doing it. They're fearing you into this lack of GLP, or the lack of metformin, or the lack of whatever medicine it is. They're not fixing anything. Vanessa, and now I love you. Well, thank you. I don't know what got you, but Fix says, how about fresh veggie and fruit and protein? For what? What is the essentialness of fruit? It's essential if you want liver fat. It's essential if you want glycation going on. Look at somebody who eats fruit. Look at their skin. Look at their face. Look at the wrinkles on their face. On a person who eats fruit. They're going to have increased amounts of wrinkles. Trust me. I see it every day. There's 10 times more glycation of fructose going on than glucose. If glucose is a 1, fructose is 10 or 7, 8, 9, 10. Glycation is gumming up proteins. It's gumming up collagen and elastin in your skin. let alone it's gumming up all of the proteins in your body. That's what sugar, glucose or fructose, does to proteins. So if you have elastin and collagen in your skin and you eat a lot of glycation products, you're going to have the results, which is wrinkles. Okay? And if you think that you're destroying your collagen and elastin in your skin, what are you doing to the inner lining of your arteries, which has elastin and collagen? Oh, I'm just going to take arterysil for that. Okay, that's a great thing to bump up the elastin and collagen. It helps to heal the glycocalyx. Okay, I can see that. Are you going to take it forever while you eat your fruit and your sugar? It's up to you guys. It's up to you. Mary says, honestly, I feel so silly now conforming to the COVID nonsense rules. I know better now. So it just took that one thing, and now you know that you need to use your brain. You need to think logically. You need to think logically. Every one of us gets scared. We're scared of having heart attacks. We're scared of having strokes. We're scared of dying. We're scared of the unknown. We're scared. And even me, okay? There was, I think, me talking to others and saying, okay, I'm scared. Yeah, me too. But let's think logically about this. And so when I had other people saying, okay, let's think logically, and then we go through it. I had patients that did this with me. We just sat there. Neither one of us knows anything, right? We're just all in this together. We're like two people saying, okay, let's break this down. Let's think logically here. What is going on? And that's how it eased me. And another thing, I'm going to be honest with you, and Mary, I don't know where you sit on this, is, you know, if God is ready to come get me, if my day to go home and Jesus says, it's now, I'm going home. That is my home. This is a temporary place for me to where I have been commissioned to share the gospel. That is the truth. We are all going to die. It's when is our time? When is our timeline? Now, I'm not going to be flippant with my health. I'm going to take care of this, and you guys know this. I'm going to take care of my temple. My temple houses the Holy Spirit. And I'm going to be all about tidying up my home, making a perfect place for the Holy Spirit so that he's not distracted in telling me how to lead my life. Okay? But when I die, I'm going to heaven. Where are you going? That is the question. If you don't care, neither do I. I mean, I do care, but I'm not going to make a decision for you. I can't drag you. I can't do any of those things. It's just me using my logical voice. And if my time was during COVID and it was the most horrific time for people to be damaged by others, is it a population control? I don't know. Or depopulation control? Possibly. I don't know. But biblically speaking, these things are going to happen. And we need to keep Jesus real close to guide us. And that's my perspective. You don't have to have that perspective. That's fine. I mean, I wish you would, but Yuli says, I know you were on carnivore. I said I was going to only do one more. I'm sorry, you guys. I just keep going, don't I? I know you were on a carnivore diet. I'm actually not. I'm probably more ketovore, okay? I drink some coffee. I eat cottage cheese. So I'm not completely carnivore. How do you get your vitamin C? I don't need very much. I need 15 milligrams. If I've been eating like this for coming on 4 years. If I had a problem, thank you for the gift, Carol. If I had a problem with vitamin C, don't you think I would have scurvy by now? The reason we overdose with vitamin C is because of carbohydrates. If you eat carbohydrates, those carbs, glucose, binds to the exact same receptor as vitamin C. So you need even more vitamin C to knock the sugar out of the receptors so the vitamin C can do its job as an antioxidant. So I don't need 5,000 milligrams. I need 15. Make sense? I'm not going to eat fruit. It's full of sugar, glucose, and fructose. There's no essential glucose or fructose that my body needs. Do I need vegetables? Absolutely not. There's no essential vegetable. Do I need a supplement? No, my body is perfectly, God made my body perfect. Now I can mess it up. I can eat just red meat, and then I'm going to have a copper problem, I'm going to have a zinc problem, I'm going to have a thiamine problem, I'm going to have a glycine problem, I'm going to have a whole bunch of problems. So I don't just eat red meat, muscle meat, just meat. No, I might eat a variety. I might eat some sardines. I might eat some cottage cheese. I'm going to eat some organ meats, the caveman special. But I don't need vegetables. Yeah, Mary, absolutely. Yep. Amen, Penny. Fick says hormonal therapy. What about it? You need therapy? You have a deficiency of hormones? I bet you don't. I bet your adrenals are perfectly matched to make your hormones in the future. Is CRP even useful anymore? It is in context with other things. I like to have a high sensitive CRP. Bobby says, I just got my blood test. What do I do now? Email me, ironladydoc@aol.com if you want to sign up for a consultation. I'll send you all the fee schedule and all that, and you can decide. No offense taken if you say, hey, yeah, Dr. Jensen, I think I'll pass. That's fine. It's only for certain people. That's fine, just a chill guy. Take it down. And if you decide later on to do a consult, that's great. All right, you guys. Okay, so we'll call it quits today. I know YouTubers, I didn't even get close to answering all of these things, okay? I just skipped right to the bottom. And 1910 says, I love sardines. I've been less sensitive to the sun after increasing sardines, eggs, and meat. Excellent. I love eggs. I love eggs. I actually had to cut down. I was eating, oh, geez. I bet I was eating 10 of them a day. So I cut down right now to 4. Okay, you guys. I'll try to think of a topic. If you have a topic and you want to email me a topic for tomorrow, Sunday's live stream, email me, ironladydoc@aol.com, and I'll decide if that seems like a good topic to talk about, okay? Maybe we'll have 3 or 4 different topics. Who knows? All right? You guys have a blessed Saturday. Lord willing, I'll be back on Sunday at 10 a.m. Central. Okay? JB, you have a great day too. And you're welcome, Sarah. Thank you for all of you being here. It tells me, honestly, it tells me that you want to take the reins on your healthcare and you just need a little incentive to get it done. Let's do this together. We're all on a journey. I don't know it all. You don't know it all, but our brains together will know it all. All right? So have a blessed Saturday. See ya.